Hello, welcome back to another Nurtured Conversation. I'm Skylar.
I'm Jeannie.
Okay, today we're going to talk about the risks of hormonal birth control. I think, I don't know, Jeannie, you probably know better than I do. Most, if not all, moms to be or women in general on birth control. We'll talk through like the side effects on fertility, effects on pregnancy, and more. So why don't we start with talking about the short-term side effects on fertility?
Yes. So, I also want to clarify, like, we're not here to bash hormonal birth control. It is a tool, and, reproductive freedom is a thing that women need. And, there are lots of methods out there. So what we want to bring to today's conversation is, you having informed consent about knowing all the information, because I know and probably all of the women who are watching this have walked into a doctor's office at some point in their life and been offered birth control without really much talk about the side effects. Yeah. Even as early as 13 years old, I was at a dermatologist and having like teenage acne, and they were like, here's birth control. I'm thankful that my mom refused it, because there are so many things that are downstream effects. Like any medication, it's a medication. There are side effects. And what we want to do here today is make you aware of those, because those side effects can have a larger impact on you over time, the longer you take these medications. And especially in this time of life when our hormones need to have a certain presentation to allow for healthy pregnancy and postpartum and fertility in general, Yeah. So that's my caveat.
And we talked about like when the best time to kind of discontinue that use, right? And how long it would take to kind of cycle out of your body. Yeah. Not sure which discussion that was, but it was early on.
Yeah. I think that was our fertility conversation.
Yeah, fertility conversation. Yeah.
But, as far as short-term side effects go on fertility, you have to expect a delayed return to normal ovulation for you. And that time frame increases with the length of time you were on birth control. So if you did go on birth control, when you were a teenager because of painful periods, acne, or any other reason for birth control, you have to allow, sometimes up to 6 to 12 months to return to normal ovulation. That would not be surprising if you've been on them for a couple of decades. Most women will resume ovulating normally within 1 to 3 months, but it can be longer. And it also depends on the type of hormonal birth control you're using. So injectable methods like the Depo shot can take like 6 to 18 months for those hormones to clear your body. So it will happen, but just expect a delay. There's no study that's suggesting a long-term impact on fertility for most women.
Is the Depo shot, is that like a new thing? Okay.
No, it's not. It's
okay.
an injectable. So it's rather than an oral you have to take every day, or something that you would need to change out. It's just you go in and get a shot and that's it.
Okay. Interesting.
Yeah.
We still have like that container with all the little pills people.
Yeah.
Anyway, sorry.
Yep.
Still a thing. All right. Talk about any underlying issues that they may be associated with birth control.
Yeah, I think more than underlying issues, it's masking underlying issues. Okay. So, again, in my experience, and I know many other friends and women who have gone through this, your OBGYN might recommend birth control to regulate your periods, regulate your cycles. But what that doesn't do is resolve the issue. Mm-hmm. So if you were having irregular cycles in your early 20s and then mid 30s, you're ready to get pregnant and you come off birth control, guess what? Those issues were never fixed. They were just masked. For me, like I was diagnosed with PCOS in my early 20s and just given a birth control prescription. And, you know, when I was ready to come off of it and address the issues were still there that were affecting fertility, and it might not be apparent until you discontinue use with birth control. So if you know you're one of those people that went on birth control because of, you know, regularity or hormonal issues, definitely give yourself a little more time to come off your birth control and address any underlying issues that may still be present.
Got it. How about long-term side effects on fertility?
Yeah, I mean, there's no evidence of permanent damage from hormonal birth control. There's, you know, not even a link between hormonal birth control long-term, like 5+ years, and reduced fertility potential. But you know, it is something to think about in terms of nutrient depletion. The longer you're on it, the longer those nutrients have been depleted. And we'll talk more in detail about that coming up, about the certain nutrients that it does deplete, that take more time to replete. So yes, there are no long-term fertility side effects, but you know, you do need to be aware of the general side effects of being on birth control and how to replete your body after being on it, especially longer term. Yeah.
So you go through the ideal 1 to 3 months of being off of it, you get pregnant, no fertility issues. What about like effects on pregnancy once you are pregnant?
Yeah. So that's where the nutrient depletion comes in, right? Like even if you have been on hormonal birth control for 2 decades, you come off and, you know, everything goes swimmingly, you get pregnant and within a few months, wonderful. But your nutrients have been depleted. So you will most likely, unless you've been taking really high quality prenatal vitamins for a long time.
As you should have been.
Yes. You are likely low in some really critical nutrients. You know, the one that always comes to mind for people around pregnancy is folate. And oral contraceptives, hormonal birth control, they lower blood folate levels, which increase the level of neural tube defects. So, you know, be aware that, especially if you're considering getting pregnant, you need to focus on getting a high quality form of methylated folate in higher doses, and optimally getting your labs checked before you decide to conceive, because folate especially is one of those ones that, you know, it makes a difference earlier on before most of us even realize we're pregnant. B vitamins are another one that are really well documented how hormonal birth control depletes them. They affect energy metabolism, fetal development, methylation. B6 deficiency especially is one of the ones that contributes to blood clotting. Like we all know about blood clot risks. That's kind of one of the things that is disclosed. But B6 deficiency definitely related to risk of blood clots or thromboembolism. In general, the B vitamins you want to watch out for depletion are B12, B6, and B2. We also talked in previous episodes about vitamin C and E and how they're such powerful antioxidants and protective of egg quality and lowering inflammation, protecting against oxidative stress, which is really important in this conception window where you're trying to get pregnant. So, you know, when they are not replete, when you don't have high levels of antioxidants, it could impact early pregnancy health if it's not corrected. Minerals, magnesium, zinc, selenium, those are all the big ones that we talked about that can be tied to, again, egg quality, fertility, preconception health. So the hormonal birth control lowers these levels, and reduced levels of these minerals can affect our hormonal balance, immune function, and fetal growth. Magnesium depletion in particular has an effect on our liver metabolism. And then the one more I'll mention is CoQ10. And we talked about CoQ10 in our episodes around fertility. And hormonal birth control lowers CoQ10. Research is showing that. And CoQ10 is a really important mitochondrial antioxidant, which is so important for egg quality. We talked about how mitochondria is so much more dense in our egg cells, and it's so important for fetal development. And we just want to be sure that we have our mitochondria is as healthy and plentiful as possible.
Yeah.
Yeah.
At every stage of pregnancy, from
Yes, exactly.
Conception to conception and throughout.
Yeah.
I think I read, is there any association between the birth control and your effect on gut health?
Yes.
Yeah. Oh, interesting.
Yeah, it can affect the gut microbiome. And when everything is tied to the gut.
Yeah.
Our nutrients are absorbed in the gut. So hormonal birth control is linked to some studies to inflammatory bowel disease, poor nutrient absorption. And when you're not absorbing nutrients, ideally, again, you're going to have depleted levels, and it could indirectly affect pregnancy readiness, fertility, and your body just being able to produce a healthy pregnancy.
Yeah, people with IBD, Crohn's, things like that.
Yes.
You're super aware of that. How about beyond pregnancy and fertility and in general with birth control?
Yeah. One of the big ones that's coming out in a lot of research is thyroid disorders. Okay. They can alter thyroid hormone, the cocktail of thyroid hormones in our body via thyroid binding globulin. It's depleted from birth control. So what we suggest, especially if you've been on birth control for a long time, or if you're experiencing recurrent miscarriage and you're starting to dig into what the causes are, do an in-depth thyroid screening. Look at TSH, free T4, anti-TPO, look at the thyroid antibodies, all of that. It's better to know rather than not know, what issues could be plaguing you. Right. If you're really just wanting to think about what you can do without getting lab testing, even just kind of like a holistic strategy to start out with, just coming off birth control and protecting your thyroid, focus on foods rich in selenium, zinc, and iodine, like Brazil nuts, seaweed, or supplements that contain those, like I Am Nurtured. And just keeping an eye on that. If you know that you already have thyroid issues, whether it's Hashimoto's or other baseline thyroid health issues, be more aware of this and be, have your doctor on board with getting these tests fairly regularly. Yeah.
Aside from thyroid, any other risks?
I think, especially in women who use hormonal birth control long term. So we're thinking like past age 35. And when there are other confounding contributors like smoking, there are increased cardiovascular risks like blood clots, heart attack, and stroke. Those are very serious and they're not very common, but they are tied to them. And they're not directly related to fertility, but, they are effects of these hormones you're introducing to your body, and they're synthetic hormones, which is, different from, we can do another episode on this later, but, down the line, when you're talking about perimenopause, hormone replacement therapy is becoming very in vogue again, appropriately so, but they use, there's a difference between synthetic hormones and bioidentical hormones and how our bodies handle them. So that's a good no. And then, longer term, another effect is hormonal birth control is tied to reducing ovarian and endometrial cancer risk, but it slightly elevates the breast cancer risk. So again, something to be aware of, especially if you know genetically or you have a family history of breast cancer. Yeah.
Wow, that's a lot.
Yeah, it's a lot.
It is a lot. Any other considerations to be made, maybe holistically and such?
Yeah, I talked a little bit about our liver metabolism. Hormonal birth control impacts our body processes how our liver processes hormones. And that impacts how our hormones and nutrients are metabolized. It can exacerbate the depletions that we talked about with nutrients, folate, B6, magnesium. So just being mindful that these, like we said, medications, they're pharmaceuticals. Words are a struggle today. They do have these downstream effects. If you're focusing on like the oxidative stress in your body, amp up the antioxidants you're consuming, vitamin C, vitamin E, CoQ10, because the hormonal birth control can increase just sort of systemic inflammation in your body, which is a concern if you're trying to conceive or you're in the postpartum recovery period and you're really trying to bring down the inflammation in your body and let it focus on recovery rather than protecting itself from these synthetic hormones.
Right.
Another thing I'll just mention is if you're looking for ways to avoid hormonal birth control and, bring back regularity to your cycles, looking at non-hormonal methods. There are you should talk to your doctor about the options available. There are things like copper IUD and others. They all have side effects. Like when you're putting something in your body, there will be a side effect. But there are other natural methods, like the fertility awareness method is getting a lot of traction now. It just has to deal with tracking your cycle, not involving any external hormones. So it's working with your body, helping you like chart and also reveal any nutrient-driven hormonal imbalances. So that's really helpful too. Yeah.
Okay. Maybe some people are like, whoa, what do I do?
Yeah.
That was a lot of information. Like I'm looking, talk to me. I'm the one I'm going to discontinue the use of my hormonal birth control. I want to try to have a baby. What can I do? How can you help me?
Yep.
What can you recommend?
Yes. Number one is repletion. You just want to focus on repleting anything that hormonal birth control has depleted. So of course, we're going to emphasize a really high quality prenatal vitamin. Make sure that the ingredients are bioavailable. So methylated folate, not folic acid.
Right.
A really strong B complex, you want to be sure that the B vitamins you're getting are in the proper active forms. A lot of prenatals out there just use the cheapest ingredients possible. Look for pyridoxal 5-phosphate with your B6. Others, methylcobalamin for your B12. Make sure that your prenatal has magnesium, zinc, and the antioxidants we talked about, vitamin C, vitamin E. And you can use these during your use of hormonal birth control to mitigate any risks. You should be, you may hear your doctor saying any women of childbearing age should be taking a prenatal, and that is true. It's helpful. It's, you're never going to have downstream negative effects of supplementing with really high quality forms of vitamins and minerals. Yeah.
At therapeutic doses, like you find it in our supplement. Because a lot of them, when your doctor says just take a prenatal, you got to dig in a little bit and really, it involves research to find out like how much should I be taking? Like what is the RDA for these things anyway?
Exactly. And, RDAs are questionable.
Low.
We can also talk about that in another time, but you'll often see in really high quality prenatals, you'll get 1,000 or 3,000% of the RDA in certain nutrients like choline, because the RDAs haven't been updated in so long. The new research is supporting much higher doses are much more beneficial. So, don't go with the cheapest thing you can find at Target or CVS. Like with supplements, you get what you pay for. And it really is important, especially if you've been on hormonal birth control for a longer period of time, to go for quality. Yeah. Excellent.
Timeline, anything else around how we can correct?
Yeah, we talked about, sort of that like 6 to 12 month washout period post birth control, once you come off of it, just to restore your nutrient stores and assess how your cycles are cycling naturally.
Yeah.
Especially for injectable birth control users like the depot shot we talked about. We always encourage nutrient testing. You know, it's a smart thing to do. So when you cycle off your birth control and you're entering into the stage of trying to become pregnant, work with your doctor to get those labs done and see where you need to do, you know, a little extra work as far as supplementing.
Yeah.
And it doesn't, you know, don't lean all on your supplements. The supplements are an insurance policy. Do it through your diet. We are food first, right? Highlight those really nutrient-dense foods. So like the dark, colorful, leafy greens are high in folate. The nuts and seeds are high in magnesium and zinc and selenium, especially for Brazil nuts. Berries, super high in antioxidants. So go for the real darkly colored, nutrient-dense foods, and those will, you know, contribute to this army of supplementation to sort of counter these depletions more naturally.
Yeah. Solid. Anything else you want to touch on, sprinkle in here at the end?
I think that's a lot for what, you know, a lot of the information can be overwhelming. And bottom line is work with your doctor on this. Yeah. Be aware of your symptoms, track them if possible. You know, there are a lot of apps out there where you can track your cycles. It helps to also track your symptoms. A lot of times, you know, our mood can go haywire when we're coming off these hormones that we've been on for decades. Just be aware of it and write it down and work with your doctor to get that testing done and see if there are any deficiencies that could be, you know, a more true cause of some of the uncomfortable symptoms you're experiencing. Because, you know, you also see a lot of times now people enter into these a fertility journey and are, you know, not finding success when there can be very simple solutions involved. You know, when we correct for some of these things and you can avoid the recurring miscarriage or the long delays in fertility by sort of working backwards, you know, making sure you're starting long before the actual goal for when you want to get pregnant to replete your body. Yeah,
there's so many conditions and diseases of deficiency. And so just like, I mean, even as simple as, you know, working with a dietitian, keeping a photo or food log, even looking at that and, hey, you know, you're really not getting enough leafy greens, your folate's probably low. Let's up that to 2.5 cups a day or whatever that is, and work that direction too. And then there's a number of companies now, Function Health is one and others. Well, you pay for it, but it may be easier in some cases to get those labs drawn as opposed to going through your doctor.
Yes.
But
lots of doctors will pull basic labs and some will, you know, if you know what to ask for, they will.
You gotta know what to ask for. Exactly.
Right. And I'm aware, you know, working with a functional, like naturopathic doctor is often really expensive and that's not in everyone's budget. Right. But having those companies like Function Health where you can go in and select the labs that you want to have drawn. Often those are covered by HSA or FSA plans. So do what you can through your primary care doctor and insurance avenues. And then if you have an HSA or FSA or have to pay out of pocket, you know, it's one of those things where it's better to know than deal with the potential downstream effects of not knowing.
Excellent. Awesome. Thank you.
Thanks for tuning in.
That concludes another Nurture discussion. If anyone, I hope you enjoyed. That was a lot of information, Jeannie. Thank you. If anyone has a topic or question, please email us, hello@iamnurtured.com. Leave a comment, and we look forward to presenting, discussing the next topic next time. Thank you.
Thank you, guys.